Mrs. Jones. My name is Jessica, and I'm going to be the student nurse doing the assessment for you today. So I'm just going to sanitize my hands. And can you please confirm your name and date of birth for me? Okay, and I will check that against her band, and I see that is correct. Okay, I'm now going to note the number on her band, which is the correct identification for the baby. The baby should have the same exact number on her ankle and her armband. So I'm just going to put my gloves on. Can you please tell me your baby girl's name and date of birth? Okay, so I see the name, the date of birth is correct, and the number on the ID band of the mother is the same on the armband for the baby, and the name, date of birth, and number are the same for the ankle too. And I will then check the umbilical cord clamp. I see that the number is also the same on this. This is Mrs. Jones's baby. Okay, so what I'm gonna start off by doing is I'm going to be looking at her breathing. So immediately I'm going to notice any cyanosis around the mouth. I'm going to be looking for nasal flaring, and I'm looking for chest retractions. So I see that there is none of that. So I'm going to listen to her lung sounds now. This is a neonatal stethoscope, or would be in practice. And I will be listening to, after cleaning this with alcohol swab, I will listen to the baby's lung sounds for a full minute and be counting her respirations. Her respirations should be in the normal range between 30 and 60 breaths per minute. So I see that she is within her normal range, or within a normal range, and I will now be assessing the apical pulse site to assess her heart rate. So I'll be listening to her heart rate for 1 full minute at the apical point, and I will be noting any murmurs that she might have, if she has them. And after a full minute, I determine that her pulse rate is within the 110 to 160 beats per minute normal range. Perfect. Okay, so now I'm just going to listen to her bowel sounds for 1 full minute. And this baby is almost 24 hours old, so she has passed her first meconium stool. She is breastfeeding. She's been getting a pretty good latch, and she has active bowel sounds. So perfect. All right. So now what I'm going to do is I'm going to be looking at the baby's head. So I'm going to be noting her sutures. I'm going to be seeing if they're overriding, which they are, and I will document that and reassure the mother that this is normal. And I will be noting if she has a cephalohematoma or a caput, which she has neither of those. I will be palpating her anterior and posterior fontanelles, and they are neither bulging and they are neither sunken in as well, which is perfect. I'm going to be noting the movement of her neck. She moves it freely, and there she has it symmetrical. I'm going to be looking at her ears, which are symmetrical. They are in line with her eyes. Her eyes are symmetrical, and her nose is patent. Her mouth, I can see she has no cleft lip. She's got moist lips. There's no dryness or cracking. Earlier when she was crying, I made sure to take a look with my pen light to check for a cleft palate or any Epstein pearls, and she has none of those. So her tongue moves freely, and again, she has been getting a good latch, so no problems there. So next, I will be looking at her spine. So I'm just gonna loosen the diaper a little bit, and while I'm doing this, I'm noticing her good range of motion. All right, so I'm just gonna turn her a little bit, and I'm assessing the spine for any dimples or tufts of hair or any abnormalities that could indicate spina bifida or anything else that is not supposed to be found in or that's not a normal finding. So I'm also going to be kind of noticing her gluteal folds and that they are symmetrical. And while I had her turned, I would also listen to her heart and her lung sounds from her back. So I'm just gonna button this up again. And all right, so next what I'm gonna do is I'm gonna take her temperature. So I'm gonna take it in the axilla. I'm gonna put it into the fold of her, her little skin fold there. And I'm gonna hold it there and wait for the beep. So after a couple seconds, it's gonna beep, and the reading is 97.7, which is perfect. All right, that's great. And if the baby hadn't had her blood pressure taken in 24 hours, or if she was getting ready for discharge, I'll take her blood pressure. So next, I'm going to be assessing her skin. So I'm looking to see, I'm looking for any findings of milia around her face. I'm looking for any marks of a forcep or from the suctioning. I am looking for any scrapes and abrasions. I'm looking for port wine stains, Mongolian spots, and any of my findings, I'm going to chart those. So I see none of that, and I didn't see any on the backside either. So now I'm just going to be looking at her clavicles. So I've noticed that she's got a very good range of motion. She's been moving her arms, and that indicates there is no damage to her clavicles. And so it's not broken. So next I am assessing her chest. So her chest she does not have a barrel chest. We've already listened to her lung sounds. We've noticed that there are no retractions. Her nipples are symmetrical and patent, okay? And she has no signs or indications of abnormalities. Her respirations are within normal ranges. Okay, perfect. So now moving on to the abdomen, and I'm just going to palpate, notice any, or how soft or hard it might be. If it's round or flat, I'm going to be noting that. And I'm checking the umbilical cord. I'm looking at that. I'm looking for any drainage or odor. I'm noting if it's moist or dry. And I'm noting that it is still on. So it's perfect, and the security device is still on too. Perfect. So next, I'm just going to be noting her genitalia. So this is a baby girl, and she looks anatomically correct. There are no concerns or abnormalities. If she was to have any pseudomenstruation, I would explain to the parents that this is no cause for concern and is normal, and they do not need to be worried. She has been passing stool and urine, and she seems well hydrated, and she is starting to regain back some of her birth weight. I do not notice any redness or thick diaper rash, anything in her genital region. And we know that her anus is patent because she has been passing stool. So I am also going to be, assessing that she has good creases in her feet, which she does. And, okay baby, here we go. And I'm noting her capillary refill, and she's got pink nail beds. So we've checked all those. Everything looks great. And excuse me. And you know, she's got good range of motion in her legs as well. Let's see here. She has 10 fingers. She's got 10 toes, which is perfect. If she was emitting also any high-pitched shrieks, this would be an indication of possibly intracranial pressure or clavicle damage, which she has not been doing that at all. So she's been very good baby, very happy baby. Everything looks very healthy. Mrs. Jones, congratulations again. beautiful baby girl. She's very healthy. So I'm then going to just swaddle the baby back up, sanitize my hands, and make sure all her safety measures are in place, make sure the mother's safety measures are in place, and I'm going to document all of my findings. And skill is complete.